Comparative Biosciences Incorporated, and GD3 have joined together to provide expert scientific resources and high-quality contract research services to all sectors within the biomedical and pharmaceutical community. Dry eye disease, DED, is emerging as an eye health pandemic affecting millions worldwide. The development of novel drugs, drug delivery systems, and targeted therapies for addressing the inflammation in DED requires progress in experimental models. Animal models were created for simulating two clinically described forms of DED, lacrimal insufficiency and evaporative DED. A rabbit is selected because of its eye globe size, and its ocular surface carboxylesterase levels are close to those of the human eye. Dry eye disease, DED, is one of the most commonly encountered problems in ophthalmology clinics, with a quarter of the patients reporting related symptoms. Lacrimal glands are critical to tear production. They provide the majority of the aqueous layer, which is the middle and largest of the three tear layers. One of the unique and customized services offered by Comparative Biosciences Incorporated. In the preparation area, the rabbit is anesthetized and the surgical site is prepared for an aseptic procedure which includes close clipping, scrubbing, and draping. This model provides a simple, optimized, non-surgical means to induce aqueous-deficient dry eye disease. It is well suited to study drug efficacy and disease pathophysiology. The surgeon wears a mask, bonnet, and sterile gloves to conduct the procedure. After the rabbit's eye area has been clipped and anesthetized with lidocaine, the surgeon then marks the area where the needle will be inserted. Using fine-tooth forceps and a syringe, a fine needle penetrates the gland directly with a transconjunctival approach. While advancing the needle, the surgeon injects a small volume of Con-A solution into the lacrimal gland. After withdrawing the needle, the surgeon applies pressure around the lacrimal gland area to prevent backflow. The rabbit recovers. This model can be useful in preclinical studies. It observes how the orbital lacrimal glands contribute to basal tear production. It also explores the ocular surface of aqueous-deficient dry eyes by examining their homeostasis and pathophysiology. This model, which is both chronic and stable, can be used in the evaluation of DED therapeutics. Rabbit model Schirmer tear test. Over a period of several days to weeks, tear production is markedly reduced. Decrease is measured using the Schirmer tear test. The cornea is examined regularly with slit lamp microscopy and tear breakup test. The effectiveness of various test articles may be determined whether they are applied directly to the eye or administered systematically. This is done by measuring the tear production, the tear breakup test, and integrity of the cornea. At necropsy, the eye and the lacrimal glands may be examined histopathologically. Tear breakup test in a rabbit. In measuring tear breakup in a human, fluorescein is instilled into the patient's tear film, where the tear film is observed under a broad beam of cobalt blue illumination. The tear breakup test, or TBUT, is recorded as the number of seconds that elapse between the last blink and the appearance of the first dry spot in the tear film. Rabbit tears have a tear breakup time that is significantly higher than humans. This aligns with previously demonstrated differences in interblink time between rabbits and humans. Understanding the underlying mechanisms of tear stability may lead to novel ways of increasing human tear film stability. Performance status rapidly reversed almost all DED parameters in its three subtypes. The normalization of suppressed corneal sensitivity suggests the possibility of marked symptomatic relief by performance status. Procedure is successful. Procedure is complete. Excellent recovery. no impairments. The animal regains mobility and generally makes a complete recovery with little mortality or post-procedural complications. So glad we could share our dry eye procedure with you. As you can see, it takes the right tools and the right people to make big things happen. None of this would be possible without you, the CBI community. For more information, visit our website or contact us by phone to learn more about our preclinical testing and research. Call us at 408-738-9260 or visit compbio.com. That's compbio.com.